You're absolutely correct. We really need to get to jobs. I notice some of our Republican colleagues are here, and they'll be taking the next hour, and I suspect they're going to pick up something that was said over and over again over the last 2 days, and I just want to put on the table some facts about what is really going on here. I heard speakers come to the floor, including the Speaker of the House, saying that the Affordable Health Care Act was the largest middle-class tax increase ever. Well, I'm sorry. However, the Washington Post fact checker said the health care law will provide more tax relief than tax burden for middle-class families. A report from the Nonpartisan Congressional Budget Office shows that an estimated 4 million individuals will likely pay the penalty because they're not going to buy insurance. Okay? That's about 1.2% of the total population. They also estimated that 16 million Americans, that's 4 times more, will receive tax credits or subsidies to help them pay for insurance coverage through the new exchanges. Now that's 5% of the population. The CBO estimates that the government will provide $630 billion in tax credits and subsidies for insurance over the next 11 years and only $54 billion in penalties, taxes, or tax increases on the middle class. So the fact of the matter is the middle class is going to get an enormous tax benefit as a result of this. Their taxes, those who buy insurance, are actually going to see their taxes reduced as they buy insurance. They'll have health care coverage at an affordable cost. Their taxes will go down. They receive subsidies. The essential point here is it is not a tax increase of overwhelming largest ever on the middle class. In fact, it is a huge tax reduction. And secondarily, there is a decreased cost to every American that buys health insurance today because there will not be a shift of cost from the uninsured to the insured and to the taxpayer. That's precisely what happens when you have some 40 million Americans uninsured. They get sick. Fortunately, in this nation, we have not yet come to the point where we do not provide health care to people that are sick and in need of care. They get it at the emergency room. They get it at the community clinics. It becomes what is known as uncompensated care. In other words, not paid for directly by the individual, but indirectly by every single American that buys a health insurance policy and every company that buys a health insurance policy and the American taxpayers. The Affordable Health Care Act does not increase the cost of health care in America. In fact, it has the significant potential of decreasing the cost, and in the last 2 years we have seen the health care cost in America decline to the lowest inflation rate ever in the last 50 years, except 1 year. Let's get the facts correct, my colleagues. If we're going to talk about tax increases, get the facts correct. Talk about the tax reductions at the same time. Talk about the fact that the Affordable Health Care Act has, while in effect, has actually been part of an overall reduction in the inflation rate of health care. And in the Affordable Health Care Act, there are very significant, long-lasting, powerful reforms that will bend the cost curve of health care, such as electronic medical records. The repeal would wipe that out. Gone. Clinics, primary care clinics across this nation, are funded through the Affordable Health Care Act. And where do you think people get care today? In those clinics. They don't get care there. They're going to the emergency room at 5 or 10 times the cost. There are vaccinations for our children, which incidentally, in the appropriation bill, our Republican friends tried to eliminate many of the vaccinations. Fortunately, it didn't happen. There's preventative care for seniors so that their blood pressure, so that diabetes is controlled. Today, our Republican colleagues voted to wipe out preventative care, not only for seniors, but beginning this August, a month from now, every woman in America will be able to get preventative screening. Mammograms, pap smears, blood pressure testing. That's what's being lost here, all in the name of some political opportunistic effort to try to run out, once again, what you thought was successful in the last election period. Well, the American public isn't going to be fooled twice. The American public will come to know that in the Affordable Health Care Act, there is real benefit for Americans. Mr. Tonko, thank you for bringing us to this floor. Thank you for bringing us to the opportunity to talk about what is real. I yield back.
Representative Garamendi,